And welcome back, and we have Ryan here from NutriMeds team. Welcome back, Ryan.
Hey, Dr. Bell, thank you.
I'm going to get you to pick out your top favorite nutraceutical again, and we'll expand on it. Go ahead.
Oh, I think I would start today with Sports Energy Light. I think I would go with that because I love using it in the early afternoon.
Right. I have some in my drink right now. In fact, I put in there Brain Mag and Calm Mind as well. A little bit of Calm Mind will double the dose of Brain Mag. But the Sports Energy Light, tell us what's in it. It's going to stimulate ATP. It's going to give you all your minerals and antioxidants. It's in a nitrogen sachet. It's so powerful.
Yeah, it is. It's easy to use, like you're saying. With a sachet, you just rip it open, dump it right into a bottle of water, a glass of water, whatever you want, mix it up. It's wonderful tasting. But this is a unique formulation that delivers antioxidants like S-acetylglutathione at 50 milligrams per serving, which is a very nice dose level, along with 500 milligrams of vitamin C. It's got a whole complex, activated B complex in there that includes 2,500 micrograms of activated B vitamins. But it also has a very unique compound in it that is a methylated and bound form of caffeine. And it allows the caffeine, one, to be used at a very low dose, but create an effect that will last 6 hours. And so for people that do use caffeine and they're looking for that enhancement in energy, cognition, mental clarity, and focus, what better than to not just fall short after an hour of having a cup of coffee, but to have that benefit for 6 hours. So this formulation is great for people that want to replace coffee, use it as an alternative, really get that benefit. And then also it's great when they want to go work out and use it in so many different ways. And then the electrolytes is the last component. This has more than 3 times the amount you'd find in basically a professional version of Gatorade.
Yeah, it's amazing, isn't it? And of course, I like to throw, as I say, I've put 2 scoops of the Brain Mag and 1 scoop of Calm Mind in my drink. This is going to keep me calm, but at the same time energized, electrolyte, stable, and it's also going to, basically support and protect my central nervous system with the Brain Mag. Let's talk about these other ones too that I've just thrown in there. The Calm Mind and Brain Mag. These are amazing, aren't they? I tell them as a preps for sleep. Take it during the day to keep yourself calm and I'll lower excess cortisol levels. And then in the evening start to ramp up the amount of Calm Mind until you decide to take the melatonin time release, anywhere from 1 to 3 tablets. But you've got to start with the Brain Mag Calm Mind before then to get yourself prepared for the effect. And of course, I like to time the melatonin time release because every 90 minutes you have a little surge. Every 180 minutes there's actually, roughly 3 hours, there's a little pulse of melatonin that your brain makes. It needs the trace elements of molybdenum and some other trace elements like manganese in order to catalyze the reactions to make not only serotonin but melatonin and the brain neurotransmitters. So I like to people to time it. Don't just take it randomly. Say, I felt a little sleepy at 3 o'clock, so you go 3 hours, 6 o'clock, 9 o'clock. Well, the time to take is about an hour before you go to sleep at 9. So you take it at 8 o'clock, shut off your television, read, listen to quiet music. If your sleep time is say 10 o'clock and you've gone backward, and we also tell people the way to change your sleep time is to reverse it. In other words, to go to bed a little earlier, and your body will reset your melatonin release. And you also want to take your Calm Mind Brain Mag so that you're preparing yourself so the melatonin time release works best. Let's talk about these. The melatonin is 1 milligram immediate release. I think it's 4 milligrams slow release. And the Brain Mag Calm Mind, the Calm Mind has myoinositol, sunthein, L-theanine, and GABA. It actually has a gamma-aminobutyric acid. Alcohol, which puts you to sleep, let's say, with a glass of wine, is just a GABA agonist, and of course it has the alcohol. Whereas you can take a lot more Calm Mind and put yourself nicely to sleep, or calm yourself during the day to stop panic attacks and anxiety, which, considering this current election cycle, is pretty common. I'm having panic attacks because I deal with this news all the time, and the Calm Mind Brain Mag are my, what I call my metabolic and nutritional savior. They're helping a lot.
Yeah, that Brain Mag, incredible, because we know the benefits of magnesium throughout the body, but we just take for granted that when we supplement with magnesium, must cross the blood-brain barrier effectively, and that's just not the case. And so for many people that do have neurological type challenges and stuff, they may have taken lots of supplements or different kind of pharmaceuticals, but the fact is we need to ensure that you've got adequate amounts of magnesium throughout the body, but particularly in the brain, so that it works the way it should.
Right.
So there's been some very fascinating studies with the material that you find in Brain Mag, where it not only crosses the blood-brain barrier effectively due to the way that it's been designed, but its impact on mild cognitive inhibition and so forth that people start occurring as they age is just dramatic in what it can do. And it's like, all of a sudden, it's just like giving a muscle much-needed magnesium so that it can flex like it should. This is the same kind of thing, only it's with brain. And it's been remarkable for what all kinds of studies that's been done in animals, including things like fear extinction studies, which I know, Dr. Bell, you like to talk about.
Fear extinction and even PTSD, anxiety. Most people that are depressed, by the way, have got an anxiety and a panic component. Usually you don't find just plain depression by itself. Sometimes you get a hypoactive depression that's rare, completely by itself, where the person's just like moving it really slow. But most depression has some component of anxiety and panic attacks. The reason is that depression is a seizure disorder of the limbic system, which is why the Brain Mag will stop the seizure activity of the limbic system, so the panic attacks stop and the depression stops, because now you're supporting neurotransmitter support with Minerals Plus to have the minerals to actually bioconvert your amino acids to the neurotransmitters, and now you're calming the brain down and protecting it from seizure activity. The other things I recommend for stopping seizures are the CoQ10 ubiquinol, which is water-soluble, so it stops brain seizure and blood vessel spasm with migraines, and also Gamma E+. These are very powerful for stopping seizure activity in the limbic system, besides the Brain Mag. Really important. And the other one I recommend for the brain is Cell Detox Glutathione, which helps to stop the hydroperoxy radical. So a lot of people don't connect that there's a seizure activity in the limbic nuclei in the brain, but that's what it is. You know, we use fancy terms for it, depression, anxiety, depending on which one is dominant, but that's what's going on. Interesting, eh? So, Ryan, let's talk. What's your next favorite nutraceutical?
I think, Dr. Bell, I'm pointing people in the direction of the shakes. I think that ageless and life support and glycemic meal are so critical. I know that there's a lot of people that get fatigue, obviously, if they're going to take different pills all the time, but they still have to find that right food that can support what they're trying to do and get a good meal replacement. And most of the times when people try to use something, it's like, they don't taste good, they're chalky, they're nasty, or they just don't work like they should.
Well, we had a company.
So well.
We had a company about 5-6 years ago called Uri International, and they were making a number of supposedly organic foods, but their drinks were primarily, they were not too bad, but they were nowhere near the technology of and the supplement delivery of ours. They're basically just, if you want to call whole food drinks. The nice thing about our NutriMeds is we've got NutriComplete, the best reds and greens and goji berry juice. We have the best glycemics, which actually blocks carbohydrates, but they taste good, but they're also foods, as the Vega Pro rice and pea protein and all the other nutrients and so on. We have ageless and life support. Now, the ageless actually makes you age less because it has the DNA repair of the malignant block. It has the immunoglobulins, Immunomax, and it has, of course, the anti-aging molecules to lengthen your telomeres. So, that's what we call it, ageless. You're going to age less. And the life support supports what's called a deficient phase 2 detox, because it has sulfation, glucuronidation, and methylation pathway support. It's all the vitamins and minerals that you need in order to, if you're taking Vitamin Mineral Max Minerals Plus, you're going to get some of that all. So when I drink my breakfast, for example, every morning, is a 5-ounce glass of all those drinks put together, plus a few other things thrown on top. And it really is amazing. My daughter calls it, Kelsey, 23 years of age, with Down syndrome, she calls it our syrup. And she helps me make it every, 6 or 7 days. And she just loves, Daddy's putting this in, Daddy's putting that in, Daddy's putting in the oils. And I'll put in, of course, I'll make a cod liver liquid. I'll put in, some other things there. And it makes a huge difference when you take something like that in the morning. Your body says, hey, I got every nutrient I need in order to build a new build today. And I tell people you're cloning yourself into the future, but if you don't have the building blocks, you're not going to do a good job of cloning, are you?
No.
You know, you can clown around, but you can't clone around. Otherwise, you're going to be a sorry mess after a number of months or years of improper nutrition and lack of nutrients that are activated. A good example, I had a gentleman on my YouTube that says, Dr. Deagle, I don't want to use your stuff because it's the same stuff. And he used the word SHI, I'm not going to complete it, as Alex Jones. And say, no, I'm a functional medicine doctor. These are doctor-grade supplements given with medical advice to tell you how to substitute drugs and other lifestyle and so on so that you can actually fix problems, not just cover them up. So it's completely different. Nobody has anything like these. These are very unique. So you can't just go on Amazon or Vitacost and just say, hey, I think I can find something like Dr. D because it sounds like it. If that was the case, you could take the label of the supplement and stick it on the sore body part and it would help you just as much. But it doesn't. Let's look at some of the, we have pretty serious problems. I talked in the first hour, because Leo couldn't make it right away, about various syndromes like genetic disorders. We can give supplements intelligently based on some of its genetics or polymorphisms like Ehlers-Danlos syndrome, which is a elastin manufacturing disorder that can cause serious joint problems and chronic fatigue. We can give supplements like things that support it, like Collagen Max, like Minerals Plus, like things to support tissue reduction in free radicals, like Cell Defense Plus and Inflamex. We have supplements that are far superior to drugs because they don't create deficiency states of vitamins and minerals, but they also fix the problem, which is pretty amazing, isn't it? So, as I say, just like our gentleman that asked about the Uri International drinks, don't even think about those. We have NutriComplete, the best reds and greens vegetable drink in the world. We've got Glycemics, the best drink to lower blood sugar and insulin. We've got Ageless and Life Support. These are amazing, and people love them. And once they start them, we have incredible retention of people saying, this is my breakfast, this is what I'm going to have for a snack, this is what I'm going to use for weight loss. We've had a lot of people take our drinks and lose like 100 pounds, 80 pounds, 60 pounds. It's amazing, isn't it?
Yeah, they're so great. They work on so many different levels at the same time.
Yeah, we have diabetics. We've been able to get off insulin using our nutraceuticals like diabetoline, berberstatin, and leptometabolic, and using the drinks like Glycemics. Which, by the way, if you have even 2 or 3 ounces of it before your carbohydrate-containing meal, it'll block the carbos in the meal 2 or 3 hours later because of the special components in it that'll block carbohydrate absorption. Let me throw some for the brain. Cognition Plus. Let's talk about that for a minute. And brain power. These are really, really important to protect your brain because, the things that are going to happen as you get older, if your joints and everything else are good and your heart's good, the thing that can go is your brain and your eyes. And, of course, you want to protect your eyes with Vision Max and Can-C eye drops and also clear the infections with our new NutriSilver because a lot of eye disease actually has stealth pathogens present like yeast or mycobacteria in the anterior eye with glaucoma, for example, and the posterior eye with Toxocara catus and canis and other pathogens. So let's talk about the brain. Cognition Plus, why is it so good, and brain power.
Well, Cognition Plus is it's a multifaceted formulation designed to work on many different attributes. They're working on memory and cognition and brain function and protection of the brain from vinpocetine to bacopa to ginkgo to activated B vitamins to methylated forms of folic acid. It's a really complex formulation that hits on so many different levels because in many cases, people don't know where the dysfunction may be occurring, the kind of hiccup, if you will, or genetic sniff, that you will, that may be causing this problem for their brain function. And so Cognition Plus is really a profound formulation, and a lot of people get good benefits when they use that one.
One of the ones I mentioned in our triad for anti-aging was Anti-Age Max, Cell Detox Glutathione, and our SOD support, which is Minerals Plus and NutriDefense. Because if you do those 3 things, you're going to protect your mitochondrial DNA, you're going to protect your telomeres, and you're going to lengthen your telomeres with the Anti-Age Max, which is better than any other formula. There's other companies that try to kind of poke at one thing or another, and they have, let's say, resveratrol. But we have the dimethyl resveratrol, a special pharmaceutical grade, that's going to be released many times longer than just trans-resveratrol, which is gone in a matter of a half an hour or less. So let's talk about these things for life extension. Cell Defense Plus, what makes this so powerful for the cells, and then Cell Detox Glutathione. These 2 are pretty amazing, aren't they?
Yeah, Cell Defense Plus is an upgraded formula of Cell Defense that we've had for many years in the Nutrimedical line. But this one is an upgrade. It's basically a better extracted curcumin complex that really it doesn't have anything else in it. It's just an all-natural form of curcumin that has the extract, including the essential oils, naturally in there. And it doesn't need any unique mechanism for its absorption to be extremely high and for its bioavailability in the body to maintain many hours longer than traditional curcumin. And what we also know is many of the curcumins that are in the marketplace, Dr. Bill, are not the clinically trialed raw material like we see with this formulation. What they are is they're just curcumin knockoffs that oftentimes talk about their bioavailability but really have no data whatsoever, no published trials, no data whatsoever on what they really have been shown to do in the body. And in many cases, light's being shed on the fact that most of them do not actually deliver free curcumin into the body, which is what you need for the beneficial effects. And so the formulation here in Cell Defense Plus is the best, absolutely best form that's available in the world.
Yeah. Now, what are the other ones we want to give for the eye? Now I know Steve Levine. I've known him for close to 40 years. He was one of the head biochemists at the University of California in Berkeley. And he developed the Allergy Research Group company. And, of course, he developed their, I think they call it Optivite, which is an eye formula. Our formula now, Vision Max, is far superior to that. Tell us why Vision Max is the best formula, not just for the eyes. It's interesting and kind of, I think God has a bit of a sense of humor. The same components that protect your eye also protect the male prostate gland. Why is that? What's the story there? What's in it that makes it so amazing?
He probably designed it that way to make it easier for us, so that when we eat certain fruits and vegetables, we get the benefit all throughout the body, which makes a lot of sense that way.
Zinc, L-taurine, bilberry, alpha-lipoic acid, quercetin, and lutein extract. What makes this formula so important for the prostate to prevent prostate cancer? And I usually tell people to take it along with their NutriDefense, which is in the anhydrous catechin polyphenol. And the studies done in Japan showed that and people that took it had no cancer rates at all in 20 years, thousands of men. This formula for protecting your eyes and your prostate for men is really important, and for women for protecting their eyes, because more of our population now are exposed to more high-energy ultraviolet light, more oxidative stress from even cell phones. For example, people are finding out that they get cataracts on the side where their cell phone is dominant. Also in the car, you're finding the left eye, which is exposed to the window, is 3 times more likely to have a cataract surgery. The body is under more oxidative stress, and the highest metabolic tissue is your eye. What's in it, and why is it so important?
Well, Dr. Bill, just give me a second. Let me give you a quick,
looking at, for example, zinc on the British study did research on even acute macular degeneration found zinc important. L-taurine and zinc interact to protect the retina. Bilberry with the most dialyzable. This has, by the way, been used for 100 years to protect the eyes of pilots. Alpha-lipoic acid, and along with cell detox glutathione and our gamma E plus really protects the eye. So these are other ones that recommend gamma E plus and cell detox glutathione on the high dose. Power C, the only neutral pH vitamin C in the world, is our Power C. Nobody else has this. Back in a moment with Ryan, we're talking about Vision Max, protect your eye and, believe it or not, in males, your prostate. Ryan, we're talking about vision. The eyes are really deteriorate pretty easily, and I've got some insights into some things about eye disease that a lot of people aren't aware of. For example, most people don't aware that glaucoma is actually a stealth infection in the anterior ciliary process called the canals of Schlemm in the anterior angle of the eye. So not only do you really reduce the inflammation with things like our Vision Max and our Can-C eye drops to stop that, but carnosine D-Link and Nutritrala, because a lot of time, especially in diabetics, there's cross-linking of the proteins that cause blockage of the canals. So you want to reduce the hemoglobin A1C level, because that, combined with stealth pathogens like mycobacteria and fungi, believe it or not, that grow in the eyeball, low-grade infections, so it's mycobacteria especially, and stopping inflammation. So there's a number of components in the Vision Max that are going to help the eye health, the retina, to stop AMD and wet or dry macular changes, and also inflammation in the anterior angle that'll cause blockage of the circulatory canals at the edge or limbus of the iris, the colored portion of your eye. So let's talk about what's in the zinc, L-taurine, bilberry, alpha-lipoic acid quartz, and lutein extract, and of course it contains zeaxanthin. These are all extremely important, but the dosages we have are far higher than Optivite that Dr. Steve Levine developed years ago, which used to be a standard in most eye doctors' offices and vision clinics. This is far superior to that formula, isn't it?
Oh, for sure. I mean, we talk about this, it's a consistent theme. Is reading a label is one thing. Making it look like it's going to be great is one thing. But having the true bioavailable nutrients, the ones that can overcome like genetic SNPs, so that you can get access to them and use them. You could be somebody like me that if you were to take a non-activated B6 and give it to me, that literally leads to neuropathies developing. So there's many reasons that people do need to have these more bioavailable nutrients. And then also minerals, for example, they compete with one another. And so by the way that the Nutrimedical line is designed, the Nutrimed lines are designed with the albion chelates so that they don't compete with one another. So you can maximize the absorption and the benefit. So oftentimes, I know you said, Dr. Bill, patients come back and they go, I've taken either a multivitamin or a formulation like Prostate Flow or whatever, and say, I don't know, it looked like it was going to be the same thing as something else, but this works so much better. Why? And it kind of comes back to that same thing. Bioavailability is critical.
Yeah, it really makes a huge difference. One of the things I think people should realize is the other components in our eye formula, and I want to mention this too, is Gamma E+, cell detox glutathione. The Gamma E Plus and cell detox glutathione are very important for the eye, as well as if you're diabetic and you have an elevated hemoglobin A1C, you've got to reduce that. We use Nutritrala and carnosine D-link to reduce that. The first step, though, is the cell detox glutathione and Gamma E Plus. And the new Gamma E Plus is so powerful, it even stops the free radical damage that causes hair follicle dropout and senescence, so it even blocks balding. So our balding protocol is recidival hair tonic that blocks the male receptor in the hair follicles, and then the Gamma E Plus will actually stop the hair from going senescent due to the nitroperoxy radical in the hair follicle that actually turns the genes off. Interesting, eh? So,
absolutely.
Anything else about Vision Max? Okay, so that's one of my things about Vision that I think is particularly important. Another is vascular health. Most people are not aware if I ask questions, and I like to AXE questions from somebody. As I say, I learned a long time ago that the most intelligent person in the room isn't the person that thinks they have all the answers. It's someone that asks the best questions. What's vascular disease? I start off with simple things. What is a cell? What's a living thing? People give me all kinds of funny answers. It gets pretty humorous. Vascular disease, and this is a summary, is infected biofilm on your blood vessel walls. Infected biofilm generates free radicals and eventually results in calcified plaque. Now, if you're trying to stop that, you want to take our nutraceuticals like Supernox to release nitric oxide. You want to take Gamma E+. You want to take things to help the vessel health, like transketolase, like the Omega Cod Liver Liquid, Omega Supreme Krill, Omega Supreme with our new formula that's super high absorbed. Let's talk about these for a minute. When you just take the Omega, and we have these new super absorbed gels, which is new technology. Nobody else in the world has this. You cut the vascular disease of all types, deep vein thrombosis, heart attack, stroke, calcified plaque, in half. Just that one thing, just doing that one thing, changes the chances of a vascular event by 50%. That's pretty amazing, isn't it?
Everybody should pay attention to that.
Yeah, we'll be back in just a moment. Brian will talk about that in a minute. For his vascular health topic we're talking about is vascular health. We've got, of course, the CoQ10 and CoQ10 ubiquinol. We've got Vascucare, propionyl carnitine. We have the Supernox, which is really important for nitric oxide. We have things to protect the vessel wall, such as vein-away, diosmin, transketolase support with the fat-soluble thiamine, ultrathiamine B1. We have their new special super-absorbed form of omega fatty acids and Omega Supreme, which we're now calling Omega Supreme Pro, a little minor change in the title. We have Omega Supreme Krill, the highest concentration of astaxanthin of any krill oil on the planet. Mega Reds is 17 micrograms per capsule. Ours is 2,000. There's really no comparison. We have things to stop free radicals in the blood vessel wall. Our nutraceuticals are amazing. Like our NutriDefense will stop the Fenton reaction. Free iron, we can detox the heavy metals. with Kilor Max to pull out the heavy metals like arsenic, lead, mercury, etc., that can catalyze the reaction to cause oxidation of the blood vessel wall. Let's go through some of these, because people need to realize if you deal with each of these components, the best test for your heart is not a test of your total cholesterol. It's a high-speed CT scan to look for the calcified plaque causing, for the we call it infected biofilm, causing calcification of your blood vessel walls and forming unstable plaque. So let's talk about this for a moment. Let's go through some of these nutraceuticals: Vein-Away, Supernox, Gamma E+, CoQ10, ubiquinol, etc.
Yeah. Well, I think a formulation like Gamma E Plus really paints a distinct picture between what people have access to and what's available, through the NutriMed line. And for a lot of people, they've heard of vitamin E. They know vitamin E is very powerful. Even a lot of cardiologists love to use vitamin E, even personally. However, they're very unfamiliar with the different tocopherols, as well as what's known as the tocotrienol content of the material. And what often happens is there's studies done even with vitamin E where it can show it's not very beneficial, and that's because people are just consuming one of really what are 8 components of vitamin E that you'll find in natural plant components.
Right.
And so they get these one forms, they overload it, and it doesn't work like it's supposed to. No duh, because they're actually blocking and inhibiting the benefits of what they would have gotten had they eaten a more natural complex. So that's where something like Gamma E comes into play, and it's the whole 8. All 8 of them are available, bioavailable, and very powerful in what they've been shown to do. So that's something that if you are taking vitamin E really seriously, you need to look at what you're taking and then talk with Dr. Bill.
Yeah, and if people won't think that they can't measure it, you can measure 8-hydroxy-2'-deoxyguanosine, T-bars. You can measure other oxidative markers to indicate that you've cross-linked your DNA or oxidized fatty acids. You can measure at research labs with Dr. Phil Broughton antibodies against oxidized cholesterol called 9-noronyl hydroxycholesterol. So there literally is autoimmunity and cytokines that result from the damage. You can see an increase in levels these are like research tests, soluble ICAM 1 and 2 that are increased in people that have it. We also see increase in brain peptides in people that are chronically stressed with congestive heart failure called brain-derived beta-natriuretic peptide. What people should understand is this is the body trying to adapt to poor perfusion and free radical damage, and the current approach that people take toward heart disease, just chasing cholesterol, is wrong-headed and doesn't work. If you're trying to lower triglycerides, for example, we have Neovasc that will lower your triglycerides, but we also can lower blood insulin levels with things like our leptin metabolic, dibetaline, and berberstatin. The dibetaline will lower insulin, the berberstatin will lower glucagon and also normalize the bowel wall for the upper small bowel. And the leptin metabolic will lower insulin and leptin resistance and restore the sodium potassium ATPase enzymes that regulate salt being pumped out of your tissues and cells, because everyone that's pre-diabetic and hypertensive or has a dyslipidemia has elevated blood insulin, but they also have a blockade of their sodium potassium ATPase, so all their cells are overloaded with sodium. So, there's some common biochemical processes going on. When we use nutraceuticals, we're not just covering it up, we're actually fixing it. Lowering insulin levels is important. So if someone says, well, my doctor says I'm fine, but I've got a lipid disorder of elevated triglycerides, the first thing I try to do, even to prevent fatty liver developments, because you can get a fatty liver hepatitis, is to not only use Neovasc, but also put them on leptin metabolic, dibetaline, and give them omega fatty acids to protect their oxidative stress and stop the inflammatory changes occurring in the liver, like cell detox, glutathione, and cell defense plus, to actually stop the oxidative stress in the sinusoids of the liver, so they don't get a lipid disorder induced hepatitis. And people think it's rare. It's not rare. Fatty infiltration of the liver because of the elevated blood insulin can be pretty darn deadly. You can develop a serious fatty hepatitis. Interesting, eh? But most people don't know they have a problem until they are in serious trouble and their liver enzymes are taken off like a rocket, and they do an ultrasound and see the fatty liver changes in their liver, and they go, oh my God. And this is way down the road, isn't it?
Yeah, it's pretty crazy.
It is.
pretty
It
crazy,
basically is.
Bill.
It's basically malpractice. Okay, you know. I can make excuses for it, but if I train the doctors, they'll know what tests to look for to monitor. For example, if anybody has a serious dyslipidemia, you got to do an ultrasound of the liver to make sure they're not getting fatty liver, and check their liver enzymes, right? And you know, if you're giving drugs like HMG co-reductase inhibitors, you better be monitoring their urine to make sure they're not getting rhabdomyolysis and not dissolving their muscles. I mean, I can't tell you how many people I've seen that are taking the Lipitor, Zocor, Crestor particularly bad, and then they start complaining that their muscles ache going upstairs. I'm thinking, oh my God, you're on the risk of getting a rhabdomyolysis, and they go and check their urine, and they're already getting in trouble. It's like, damn it, you know. And if you let it go too far, the proteins that come out, the rhabdomyolysis proteins from their muscles, will actually shut down their loops of Henle, and they'll actually go into renal failure. That's not funny, is it?
No.
No.
Terrible.
But you think that the doctors usually miss it until you're screwed. How's that? As they say in the military, screwed and tattooed. That's why I say, if I get tired of doing radio and broadcasting and so on, I just go in practice and be an expert witness and just be like going to the Midway, just ping, 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 knocking off doctors, drug companies, hospital corporations, just knocking them off. In fact, one of my favorite shows I'm watching right now is Suits from the Manhattan Lawyers, because I'm like half a lawyer as well. That's my other skill sets on the other side. Because I took the courses at ABIMI, American Board of Independent Medical Examiners, Stony Brook Medical Center in Medical Law, and I kind of get off on it because there's a lot of logic that's for good science that's very similar to good law. Good law and good science actually have very similar logic. Isn't that interesting? Yeah. Fascinating stuff. So, Ryan, let's go to the next area. Let's talk about, let's talk about blood viscosity. We have nattokinase. And we have also, of course, our other supplements that reduce blood viscosity, Omega Supreme, Krill, and Omega Supreme. And maybe we can mention about what we did to this Omega Supreme, because a lot of people say, well, I got an Omega fatty acid, it's fine, I just use up what I got. No, ours is so superior, it's like in a total different class, isn't it? So Omega Supreme and Omega Supreme Krill, these will really transform your vascular health and protect you from a lot of bad stuff down the road.
Yeah, the forms that are available, most people need to be aware of the quality of what they're being able to take. They usually don't have access to anything like the assays of what the material is, and truly how clean it is, from heavy metals to PCBs to anisotine values to radiation exposure of the material and so forth. And that's something that people buyer beware, because it can take things, obviously trying and wanting to do well for their bodies and even spending and investing the money. But unfortunately, in some cases, you're really not getting anything that's really going to improve. And in some cases, it may even hurt the benefits that you're trying to achieve.
Yeah, exactly. Now, let's talk about probiotics in the gut. We mentioned before that everybody has an autoimmune disease, a small bowel overgrowth, and leaky gut syndrome. You can identify leaky gut with a zonulin test at Dunwoody Labs. That measures the zonulin connection between the tight junctions of your colonocytes. You can also do a lactulose mannitol sugar test through Genova Labs that tests in your urine. If you take the lactulose mannitol, if it sneaks through your gut wall, it means you're having a problem because your gut's leaky. Large protein molecules get through the Peyer's patches in your abdominal wall of your bowel, and also the Kupffer cells of your liver. And if there's immune homology, which means there's a pathogen or a protein that looks identical to a body protein, let's say your brain or your liver or whatever tissue, your body's immune system can get activated to attack it. So autoimmunity is always tied to what's called immune homology. A lot of people don't realize that. And the immune homology is always tied to leaky gut. Leaky gut's always tied to small bowel overgrowth. So when you get small bowel overgrowth, you get a leaky gut, and large protein molecules get through to your splanchnic circulation and induce your T cells to go after and attack tissues that ordinarily are considered you. But now your body gets the message of, no, this is not you, this is XYZ pathogen that's causing trouble. So, for example, the gut wall basement membrane in the terminal ileum is identical, a protein sequence, to the fungus Saccharomyces cerevisiae. That's basically the yeast that rises bread. So obviously it's pretty darn common. So if the bread yeast looks identical to the basement membrane of your small bowel and your immune system goes crazy and attacks it, it's going to attack your bowel wall thinking it's yeast. Isn't that interesting? Same way with myelin-based protein. It looks identical to the spirochete, which is intracellular pathogen of ehrlichiosis, babesiosis, and especially Lyme. So everybody that's got MS has had a Lyme or Lyme-like parasite, and there's 34 different sub-parasite types in North America and North Europe. Now, if you ask the average doctor, even neurologist, do they think they know this? Absolutely not. They don't know about immunohomology. They don't know about these things, but if you actually do immunological testing like I've done, you actually find this out and they'll say, oh my God. So virtually every autoimmune disease has an immunohomological thing with a stealth pathogen somewhere in the body that induces an abnormal T lymphocyte attack against the tissue. So you got to clear the pathogen. You got to get rid of the small bowel overgrowth, because I'd say 3/4 at least or more of autoimmunity starts in your gut. Interesting, eh? So you want a living probiotic at least twice a day, which are Roussel strains from Paris to Pasteur Institute. You want the living probiotic ultra every second or third day. You want things to heal the gut wall like our GastroHeal, which is zinc-carnosine. You want immunoglobulins to heal the gut wall too, like Immunomax, 4 capsules twice a day. You want things to regenerate the gut wall, like our Mountain Red Velvet and our Collagen Max, because the tight junctions are dependent on collagen as synthesis. These zonulin fibers and so on are basically, you want to call it a collagen matrix that holds your colonocytes together on the basement membrane. People don't know that. They don't realize if you've got collagen biosynthesis defects, you're going to have leaky gut syndrome and localized to that tissue. And, collagen is a big deal, too, as a side spin. 78% of NBA and NFL players, just looking at the shoulder joint alone, not even looking at the ACL, PCL in their knee, have a large enough defect that they're at risk of a full rupture during a sporting event, which means, as a player gets more experience and should be better, they're more likely to become permanently injured. Just like Anderson just got injured last week in football from the Broncos. This guy's paid millions a year, but now his knee's buggered up because they didn't do a T1 weighted MRI or a weighted MRI scan looking for partial tears of his ACL, PCL. And if he was on our Collagen Max, and he wouldn't rupture it. Pretty cool, hey?
Yeah.
So the gut is really important. Living Pro, let's talk about this. Digestion is not right, so you need digestes to restore pepsin and stomach acid. Gastrozyme, they're not digesting their food properly, so they get large protein molecules getting across the gut wall. We need gastrozyme, which has everything right down to a glutenase to get rid of gluten. And then you need to heal the gut wall. You need to turn off the inflammation, such as things like Cell Defense Plus, GastroHeal, Immunomax, immunoglobulins to heal the gut wall. So let's talk about this for a minute, because a lot of people think your gut's not important, but in fact, many illnesses have their basis in your gut, including bad behavior in children, where they generate immune complexes that act as narcotic analogs. They actually can make the kid high or make them hyper because they have a gut allergy, and they can have an IgG antibody reaction that can turn on and off and affect their blood-brain barrier for up to 8 days after a burst of immunoglobulins caused by a food reaction. So it's not like an IgE that hits you immediately and your throat swells up and chokes. It can actually affect your brain or cause your behavior to become weird on and off for up to 8 days after a food reaction. Interesting, eh?
For sure, yeah. Well,
and you're not going to hear this from the regular doctors, because they're not going to know that it's affecting your blood-brain barrier and your neurotransmitter levels.
These digestive problems that Americans and people around the world suffer, it's really one of the great kind of tragedies is the fact that there's so many good solutions that people have with getting the acid levels properly balanced in the stomach so that the food goes down in the right manner as a bolus, and creates the right pH level so that enzymes work in the intestinal tract, and, as you pointed out, stops small intestinal bowel overgrowth. Because the reason that can occur isn't that you have some kind of unique pathogen living inside you. Those are just regular, normal bacterium that actually get to translocate up into your small intestine because you've neutralized the pH in the way you digest your food. You've basically taken what should have been a inhospitable, Arctic-like environment that's just nasty, and you made it tropical climate, like on the equator. Yeah,
that's really good analogy.
And basically, you allow them to translocate. And
so you turn basically the Antarctic, which is only good for king penguins, into Sandals Resort in the Bahamas.
Yeah, and you get the people from the Sandals Resort that shouldn't be there hanging out and messing everything up. And so people are I know everybody wants to kill everything that's bad, but if you just do the right things, which is digest your food properly, get the acid levels proper, you'll start passing down food bolus in the right pH, and that starts to translocate those guys back out, because you put the hostile environment back where it's supposed to be in the small intestine, where you're trying to absorb your food and nutrients more effectively, and leave that watery environment down in the larger intestine where tons of bacteria are, but you want to keep them down there, by the difference in pH.
Yeah, one of the more common things we have is a combination of adrenal and thyroid dysfunction. And there are two horses pulling the plow. And we've mentioned this analogy before. You need adrenal support, at least two capsules in the morning. You may need to repeat it in the afternoon, but early afternoon, because your cortisol level is supposed to drop during the day. And if your adrenals are stressed, your thyroid is stressed. Vice versa, if you 69%, according to the California UCLA research study a few months ago, showed that the entire population of adults are turning diabetic. Now, diabetes isn't just high blood sugar. Somebody can have hypoglycemia and high blood insulin levels and low blood sugar attacks for 30 years before they ever turn diabetic, say in the early 70s or 60s. The real issue is when you start to stress the thyroid and you're creating reverse thyroid hormone, RT3, your core body temperature is low, you tend to gain weight, you get dyslipidemia. Like Dr. Broda Barnes said, everybody with heart disease has thyroid dysfunction. And most of them have type 2, which is not where they have anti-thyroid antibodies. They've got insulin resistance and elevated reverse trials that include biotin. Biotin Plus includes, of course, energy to support mitochondria, glucose metabolism, and also your skin, hair, and nails look wonderful if you take biotin. Let's talk about bone building. Years ago, of course, back in medical school, they said, you got to take calcium. And, of course, they were talking about White Cliffs of Dover calcium. They never mentioned magnesium because the microcrystalline hydroxyapatite is what bone's made of. It needs a 2-to-1 ratio of calcium to magnesium, but it has 7 water molecules per crystal structure. It requires silica, boron, and manganese in order to catalyze reactions to create the osteoblasts, lay down new bone, to activate vitamin D, to do a whole lot of stuff. And 42% of the dry weight of your bone is type 29 collagen, which is actually the collagen backbone. It's like rebar in an overpass. So you can't build bone without rebar. I mean, just face it, whether it's membranous bone around your jaw and your teeth. And the interesting thing, membranous bone doesn't get less dense, it retracts. So, for example, if someone's getting osteoporosis of their skull actually gets thinner, believe it or not, and it retracts, it gets smaller. Same way in your jaw, you actually can see on a pan x-ray, 3-dimensional, you can actually see the jawbone actually retract away from the tooth. It doesn't get less dense. It actually pulls away from the Sharpay fibers. Now, in your spine, you can see the spicules of bone. Literally, after a while, if you do a soft x-ray, you go, oh my God, I have an OMG moment, I call it, where you see spicules that look like little Jenga sticks in the person's vertebral column. And it looks like a lot of the sticks were pulled out of there. And this is not good. You see bones that look like a shadow. That's scary, where you see the periosteal lip around it, and you see a whole bunch of little, very thin Jenga sticks, and otherwise there's airspace in there. It's like, big problem. So you've got to take Collagen Max. You've got to take things to support it with Micelle D3, and we also have Myco D2 and full vitamin K2 to build the collagen. I also recommend you take the NutriMed Royal Jelly if you're trying to rebuild collagen. And you have to build the collagen also, and you need the right exercise, which is Vibra Slim, vibrational exercise. You can use technologies to increase bone, which is an eco setting on lumen photon, or the micropulse to stimulate your stem cells 400%. And we can do peptides to rebuild bone as well if you need to, but most of the time it's not necessary. You need bone generator, which is the only stuff you ever want to take for your bones, 3 to 6 capsules, a half hour to 45 minutes after your 2 largest meals, because that's when the succus entericus, the fluid coming out of your ampulla vator and your pancreas, is the perfect pH in the 10 centimeters of your second part of your duodenum, just below your stomach, where all your minerals are absorbed. So that's the only place your minerals are absorbed, is right there. So if you don't have the right pH, you ain't going to absorb them. That's why if you take stupid drugs like proton pump inhibitors or H2 blockers, you're going to get demineralized. And this is scary stuff. So bone generator, Micelle D3, Myco D2, full vitamin K2, and Collagen Max, and you can build bone. Wow. And radical, isn't it? And if you're told anything else by your doctor, if you're told anything else by your doctor or your dentist, they're a knucklehead, walk the other way. No, run away. Run. Don't turn back. Don't look over your shoulder. Run. Because they're going to hurt you. And if you go to the pharmacy or Walmart or wherever and figure, I'll just pick up this stuff, it's as good as Deagle's, you're a fool and you will die a fool. Don't do it. Get our stuff, reverse your osteoporosis, get your DEXA scan. You can do a deoxypyridinium and pyridinium in your urine. In 3 weeks, you can show it could drop to 0 because you're not ripping your bones apart. In 3 weeks, you can do that.